All right, let's get started. So thank you everybody for coming on. Hopefully I'll be able to share some information with you. Guess I probably should start with a little bit of a disclaimer. This is the best information that exists as of today, October 11th. I'm going to apologize to anybody who sat in on the session earlier today where I talked about educational organizations. Are going to hear some of the same stuff, but there's some differences in terms of EI is a little bit different from the educational organizations. You may hear some stuff that's different. But again, from a disclaimer perspective, some information about who we are, but ultimately, if you've tried to read through the frequently asked questions, you've tried to read through the regulations, you'll realize that this program was really designed as a healthcare program. Wasn't really contemplating a lot of the educational organizations and clearly not some of the nuances of early intervention. So I've posted at least a dozen questions asking for some clarification on points, and I've gotten absolutely no responses. Having said that, I'm going to answer the best I can and give you as much insight as I possibly can give you. But please understand that the opinions or the information that's here is my opinion, my interpretation of the regulations. So, please understand that and, make sure that you kind of go through this and come up with your own thought process on this. The big thing that I want you guys to take away from this, a lot of things, but one of the biggest things is documentation. This is a program that has the ability to be audited by the OMIG. Don't know who they're going to audit, if they're going to audit, but it's been stated that the OMIG will be performing audits of these funds that are distributed. So if you're taking a position, just make sure you're documenting why you're taking position, what the position is, and why you believe that your response is accurate. So I want to take you through a little bit of the background on this. So we did a presentation on this on August 18th. And if you look at this link right here, see link here to watch, that's the link to the August 18th presentation that we did. If you didn't participate in it, I do recommend that you watch it for some level of background. There wasn't a lot of stuff that's changed between the August 18th presentation and this one in terms of the overall regulations or background with respect to the regulations. There have been 3 batches of frequently asked questions that have come out since then. The last frequently asked questions that are on the website are those from September 23rd. So there's been nothing in almost 3 weeks coming out of DOH in terms of changes within regulations. We originally thought when this whole thing started that we were going to be in a situation where there were going to be additional regulations or new regulations that came out impacting educational organizations. And obviously there's nothing new since the August 26th letter that came out. We thought that since EI is kind of a bridge between education and healthcare, there might be some additional regulations, but nothing. If anybody does, I see somebody has their hand raised, but if anybody does have any questions, if you can either post them to the questions or if you can post them to the chat, I will try to get to them as much as possible. But if you can just post any questions that you have there, that would be great. We don't have a lot of attendees, so if it gets to a point towards the end, I may open it up and let people just speak. But for now, if you can just post questions, that would be the easiest thing to do. So again, the bonus is available. You have to have eligible employer, eligible employee. We're going to talk about those. Maximum bonus you can have is $3,000. The most any one employee or contractor can get from the program, any program or any employer, a qualified employer, is $3,000 or a maximum of 2 bonuses for 2 of the vesting periods. And we'll talk about all of that stuff as we move through this. So what constitutes a qualified employer? Since this is an early intervention group, we're going to talk about it from an early intervention. Anybody in here is not really early intervention, but who's special education, you guys are automatically in based upon the August 26th letter that came out from Phyllis Morris that went around to the field, basically reiterating the fact that any 4410, 853 school, charter school, private school, school district, those are all automatically in. for you as early intervention providers, I think the most important part here is you have to be a Medicaid enrolled provider, which you would be as an early intervention provider in the state of New York. You have to bill for Medicaid services. You have to employ at least one eligible employee. And then the last part, which I think gets you in, is this C, which is highlighted here in yellow. You have to serve at least 20% Medicaid enrollees. So, if you are not providing service to at least 20% Medicaid enrollees, and you don't fall into one of the other criteria, such as educational organization or some of the OPWDD programs and things like that, then this is not for you. But I think most of the people here either have OPWDD, are sitting in a situation where there's a school with 4410, 853 services, and then are doing EI. So any of those categories are going to fit, and you're entirely into this program, so you're considered an eligible employer. So as a qualified employer, you're fine. So now let's look at who are the qualified employees, because the only employees or contractors kind of fit into that employee, and we'll talk about that in a little while. But the only employees that kind of fit into this bucket, there are several criteria. First of all, they must be continuously employed through the vesting period, must have an eligible worker title, and we'll talk about that a little bit more, cannot have an annualized base salary in excess of $125,000. And now this is kind of being looked at in two ways if you look at the frequently asked questions. It's not just $125,000 for the year. You also have to go to each of the vesting periods, and you have to look to see if you're over 62.5. Because if I've got an employee that makes over 125,000, but in one vesting period they make 65,000, and the other vesting period they make 61, they qualify in the period that they only make 61. So it's really, you have to meet both. You have to be over 125 for the year, and you have to be above 62.5 for the vesting period. If you hit both of those criteria, you are not eligible for the bonus for that period. They must complete an employee attestation. Every single employee has to complete an employee attestation. If you don't have an employee attestation, you cannot give out a bonus to the employee. If you click on the link right here, this must complete employee attestation. That's a link that'll take you to the employee attestation form. That is the form that is provided by the Department of Health. If you want to add things to it, you can, but that's the minimum level of information that's required. You have to retain that. If you try to reach out to an employee and they don't respond back, or if an employee declines the bonus, you have to document your efforts and why the employee declined the bonus. So make sure you have that documentation. You're going to find one of the themes that we're going to talk about a lot here is documentation, documentation, documentation. As I said before, this is going to be audited by the, potentially audited by the Office of the Medicaid Inspector General. And one thing that I've heard from many an auditor, if it's not documented, it didn't happen. So please make sure as you're going through all of this stuff that you're documenting stuff. If an employee is suspended or excluded from Medicaid, they're not an eligible employee. So you have to kind of look to make sure that employees are not Medicaid ineligible. And then in terms of the position title codes, if you're a healthcare, you fall under the Bureau of Labor Standards. If you are mental health, you fall under the CFR guidelines. In our case here, most of the individuals that you're going to be working with or that we're talking to here as EI providers are going to be under the IDD or mental health. So you're going to look to the consolidated fiscal report. You're going to look to Appendix R. Appendix R, for those of you who have 4410 or 853 programs, you're used to, or OPWD, you're used to filing a CFR. Appendix R is where all the job descriptions are. And when the DOH put together the list of qualified employees, they used, for a big chunk of it, the mental hygiene piece of it, they used the Appendix R descriptions. So what you would do is, if you're not sure whether an employee is eligible and fits into one of the position titles, go back to Appendix R, read through Appendix R, and then compare what your job description that you're working with an employee to the Appendix R. And if you click on this, it'll bring you to a link of the CFR appendixes, and you can go and find Appendix R. So here's a list of the employees that are qualified employees. I took the liberty to highlight the ones in yellow that I think we're going to see most often in the EI world. And I also highlighted in blue or changed the font to blue, the ones that are in the mental hygiene, which kind of fall into the CFR. And we'll talk a little bit about some of those today. If you notice on the bottom, there's a little comment there in red. It says teachers and teacher assistants are not eligible in any capacity. So when I say they're not eligible in any capacity, again, we'll talk about that a little bit more, but when you have a teacher, you have a teacher assistant, they are not going to be included. Most of the codes where you're talking about, behavioral specialists, behavior intervention specialists and stuff, all say you have to have a psychological or social work degree in order to qualify. So you just have to make sure that if someone's functioning in a capacity like an behavioral analyst or some ABA, there it's kind of clear that they have to have a ABA license. So again, you got to look at some of this stuff and make sure that you understand, because you could have a a teacher functioning maybe in an ABA capacity, or a social worker. Social worker, I think, fits because they are a social worker, but you got to be careful about that teacher and whether that teacher actually fits into that category. But you can see your case manager. I know a lot of people have asked me the question, is a service coordinator allowable? I think they are. I think if you read the definition of a case manager is pretty similar to what's reflected in a service coordinator. A clinical coordinator is basically a individual who does the supervision of your therapists. So again, as long as that clinical coordinator has the right background as outlined in Appendix R, you're fine there. Nurses, psychologists, social workers, again, all of that stuff. Just take a look if you have any questions. All other therapists, you have audiologists and things like that would fit. So hopefully this is pretty self-explanatory once you go back and read Appendix R. Couple titles that I did want to bring up with respect to Appendix R. So some of the ones, and a bunch of these are like OPWD only. I don't know per se that that means anything to the EI world, but again, you have a developmental disability specialist, which includes all individuals not included in otherwise listed titles with at least a bachelor's degree in appropriate field from accredited program. I don't know if something can fit into here. I threw in some titles that you might want to look at. Your behavioral intervention specialist 1 and 2, because a lot of you guys have ABA services. So you can see if the staffing that you have fits into these categories. Clinical coordinator, this is again one of the things I mentioned earlier, responsible for overseeing clinical aspects of the program, including staff supervision and case review. Possibly if you have a teacher who's sitting in that clinical coordinator role, first of all, I'm not sure that's appropriate because they're overseeing the clinical aspects of what's taking place within the organization. So I would think that they probably should have a clinical background. But I know somebody had asked earlier when I did this for the education group about maybe an educational person sitting in that title. And the answer there is possibly it may be an allowable title and allowable bonus if you have a educational person there, because as we'll see in a little while, the important part is the title or the classification that the employee falls into as to whether or not they are qualified. So let's shoot through a couple of the frequently asked questions. I think it's kind of important to kind of go through some of the frequently asked questions and kind of look at them in terms of how they impact the EI world. Because again, I think this is, the regulations are the regulations. The frequently asked questions, I think, is where you can kind of look at this and then create some level of interpretation of what they're trying to get at here. So one of the questions is there a threshold of hours an employee must work in a hands-on clinical environment to be eligible? So, they're looking at this in terms of, can I have someone who is maybe not necessarily in a hands-on capacity, but they're providing services, but not necessarily in completely or all of it in a hands-on capacity? And the answer is no. And if an employee has an eligible title and meets all of the statutory requirements, they are eligible. So if you've got an employee that maybe isn't providing direct hands-on service per se, or limited hands-on service, but fits within that eligible title, then they would be an allowable for a bonus. Take a clinical coordinator is a good one there, an easy one to explain. So if I got a clinical coordinator who's not necessarily providing hands-on clinical services to the children you serve, but instead overseeing the staff, for the majority of their time, clinical coordinator is an eligible title. So therefore, the fact that they're not in a direct service capacity on a majority of their time doesn't matter. They're still entitled to get the bonus. Going along with that, one of the other questions that kind of is similar to this is, are management and supervisors such as nursing, tech supervisors, dietary supervisors that otherwise meet all eligible staff criteria eligible for bonuses? And management and supervisors that also work under an eligible title and otherwise meet all criteria for eligibility may be eligible for the bonus. So again, I think this reiterates the fact that, even if someone is in a management capacity, as long as they are fit within an eligible title, so it's not like they are the program director and doing a little bit of, stuff, but, as long as they fit into that eligible title, and, the key word I think here is also. So if they're in management and supervisory and they work under an eligible title, we're good. That's all that matters. So, it's not so much the background they have or the licensure certification that we're going and looking at the eligible title. That seems to be the key component of all of this is, are they in an eligible title or not? Again, if anybody has questions, feel free to drop them into the chat or Q&A. This is, I know, another question that impacts a lot of EI providers who have multiple entities, and you've got staff that might be moving around between multiple entities. So some of the questions that you have is, our system is comprised of multiple employers versus only one employer. An employee who leaves one employer, part of our network, to go to another employer within our network, the employee would not be qualified due to not having continuous employment with the same employer. Is that accurate? And here I think it comes down to, if you are, in your case, most of you guys are going to have an MMIS number. If you don't do a lot of Medicaid billing, you may have an SFS. But if you're covered under one SFS or one MMIS when you're going through this process, then somebody can move back and forth between entities. I think you would count all of the time that they have between the various entities. And you would look at that in terms of both total hours and continuous employment. If, however, you have multiple MMIS numbers and you're filing for this under multiple MMIS numbers, then I think it's different. Then I think you're in a situation where you have to look at how much time they had under each of the MMIS numbers to determine whether they qualify and have continuous, have continuous employment and how many hours that they worked. So again, if I'm all under one MMIS, I consolidate everything. If I'm under multiple MMISs, I keep things separate. Another question that kind of goes hand in hand with this, I'm an employer with multiple MMIS IDs. Which should I use to submit for the healthcare worker program? Within the healthcare worker program portal, a provider will have the ability to link an MMIS ID to a user account. Provider can then link other associated MMIS IDs to that user account. So again, it depends on how all of this stuff lays out, depends on how things are linked. Employees should be submitted under the associated MIS that best fits the employee situation. So if I've got someone who, let's say, is working for or employed by entity A, because I know a lot of you maybe have multiple entities working off the same employer code. So if I have an employee working in entity, employed by entity A, so they're on the payroll for entity A, but they work 90% of their time in entity B, based on this, it looks like that they would be reflected within entity B in terms of the where you would reflect them for the bonus perspective. Continuing along with qualified employees, this goes back to something I discussed before. So if an employee is paid per diem and the rate of pay exceeds the requirement of 125,000 annual base pay, but the employee did not work enough to earn the full 125, should the employer submit a claim for bonus? So again, as I said before, it's A and B. So if their salary is over 125,000 and they earned more than 62.5 during the vesting period, then they do not qualify for the bonus. So if you have someone whose annual salary works out to be over 125, but they didn't work enough hours to make the 125, they would pass A, they had over $125,000 worth of base salary, but B, they didn't have enough hours or didn't generate that 120 or 62.5 in that period, then they'd be entitled to the bonus. Hopefully all of this stuff is making sense. I go the wrong way. The other thing that we're seeing is that a lot of organizations utilize outside contractors, or you guys provide contracted services to school districts. So I've got a school district that might be purchasing services from you, or you're purchasing services from outside contractors because some of your staff are not, some of your therapeutic staff and counseling staff are not on payroll. So what do we do with contracted staff? Because the bonus is for both employees and outside contractors. So if I'm on either side of the coin where I'm selling services to somebody else like a school district, or I'm purchasing services from a contractor, what falls in here? I think there are two frequently asked questions that come into play here. The first one is this one: would a provider enrolled in a medical assistance program, e.g. hospital, nursing home, who enters into a contract with the supplemental staffing agency, be considered an employer under the statute with respect to those frontline healthcare workers who are assigned to this by the staffing agency to the provider's facility on a temporary basis? And the answer here is no. Qualified employees should make claim for bonuses only for individuals they employ directly or indirectly on a permanent basis. So if I'm either A, hiring staff on a temporary basis, or I am placing staff on a temporary basis to a school district, let's say, or another provider, this says that those employees are not necessarily eligible for this because, again, if I'm the one who's contracting them on a temporary basis, then they clearly don't fit in here because it says here that they don't qualify. I have to do it on a permanent basis. Now, there's no definition as to what a permanent basis is, so we don't really know what permanent basis means, but I guess it can be implied as, this is someone who's doing this on a regular basis, continues. So we have a lot of clients who maybe instead of bringing a physical therapist on staff, they'll hire a physical therapist on a contracted basis. And that physical therapist basically works almost exclusively for our client. Well, to me, that sounds like a permanent basis. It sounds like that's what they're driving at here under permanent basis. But again, this is still open to interpretation. So I'm just giving you, as I said, my opinion. On the other side, though, again, if I'm the one who's placing the staff at a school district, and I've got now staff being placed at the school district, the interesting question comes up, well, if I place these staff at the school district and I'm placing them on a temporary basis and they're rotating maybe between different school districts, so there's no permanent basis there, the school district wouldn't pick them up. But I guess the question is, can I pick them up? Can I, are they eligible for a bonus from me or not? Am I allowed to provide them with a bonus? So that's a question that, I don't know is 100% clear. To me, it sounds like, yeah, it sounds like I should be able to, but again, I don't know that it's 100% clear. I would tell you that if you are entering into any arrangements with where you're providing staffing or someone's providing staffing to you, I would make sure you go through and have a clear understanding as to who's picking up that those individuals in terms of the healthcare worker bonus, so that we don't have two agencies picking up the same employee. Now, a second question comes in, also dealing with contracted employees, that kind of talks a little bit more about what this permanent employee is. And the question is, are contract staff eligible for the bonus? If they are, who is responsible for submitting these staff for a bonus? For example, if a hospital employs staff that fall under one of the employee titles, but are co-employed with a non-healthcare entity, are they eligible for the bonus? So when they talk about co-employed, typically have a lot of providers, let's say, who have PEOs. So they're under a PEO arrangement. PEO is co-employment. So this question deals with that, and it says permanent contract staff in eligible titles may receive the healthcare worker bonus, assuming all the requirements are met. For the purpose of the healthcare worker bonus, qualified employers that have engaged in staffing arrangements to obtain workforce services, PEOs, and other third parties. So now we see it's not just PEOs, but it's also other third parties. Guess what? Other third parties is also a phrase that is not defined anywhere. So what does other third parties mean? Does other third parties mean, as we talked about before, if I contract with Joe Smith, who's a physical therapist, and Joe Smith comes in and provides direct physical therapy services to the children I work with on a permanent basis, where they're providing it day after day, week after week, month after month for the whole year or for the whole vesting period and beyond, does that qualify as an other third party? I don't know. To me, it sounds like it is some level of a permanent employment, and I would think that they would qualify. But again, this is all subject to a certain level of interpretation and all subject to the need to properly document. It goes on to say, the qualified employer, not the contracted agency, must submit bonus claims for staff that program work for qualified employers under such arrangement. So if you are providing services, if you're getting services provided to you by an outside contractor on a permanent basis, you are the qualified employer, they are the contracted agency. So based on this, you would be the one who would be responsible for providing the bonus, because in essence, even though they are not your employee, this is where that contracted staff comes into play. So it's going to be your responsibility. I did have a conversation with one of the Long Island major healthcare attorneys, and we had a conversation about this very topic, where they had a situation with two hospitals, Hospital A, Hospital B, and Hospital A was providing contracted services to Hospital B on a what was deemed to be a permanent basis, permanent contract staff, whatever. And the attorney agreed with the position that it would be Hospital B who would have to pick up the healthcare worker bonus. And when they went back and discussed it with the two hospitals, the hospitals also agreed, and they also interpreted it that way. So there is definitely a certain level of thought process that a contractor that is providing services or purchasing services on a permanent basis would qualify. So what are the bonus requirements? The bonus requirements are based upon hours worked per week. So someone would have to work for the entire vesting period. So if you hired someone, if the vesting period starts, the one that just ended started on April 1st and ended on September 30th. If someone started in May, they don't qualify. They weren't there for the entire vesting period. You have to be there for the entire vesting period. They would have had to start prior, April 1st or prior, and they would have to stay through the end of the vesting period to have a potential of qualifying. And we'll talk about that in a minute. In order to calculate how much of a bonus they get, you would take the number of weeks in the period, which for the most part should be 26 weeks. You would take the total hours they worked divided by those 26 weeks and calculate the average hours they worked per week. And if they worked over between 20 to 30 hours, they're entitled to a $500 bonus. 30 to 35 hours, they're entitled to a $1,000 bonus. And over 35 hours, or at least 35 hours and above, is $1,500. We have a couple of clients who've already sent in the first vesting period, and it seems that DOH rounds up. So if I've got someone who worked 29.7 hours, it seemed like they rounded up and said 30 hours, which entitled them to a $1,000 bonus. So again, it does seem like they round up. When you submit the spreadsheet, and we'll talk about the spreadsheet in a few minutes, which outlines all of the data that the Department of Health needs in order to calculate the bonus. They're the ones who are going to calculate the bonus. The bonus is not reflected on that spreadsheet anywhere. So they will calculate the bonus and then they will send you the money. So I would recommend that if you are sending out, or when you send out the attestation forms to your staff to sign, I would not tell them how much their bonus is going to be. I would allow the Department of Health to do all the calculations and then submit the payment to you. And then after you get the payment is when you're going to pay out the bonus. You have 30 days from the time that you receive the money from the Department of Health to distribute the money to, or distribute the bonus to your staff. So you cannot pay the bonus prior to getting the money from the Department of Health. If you do, it doesn't qualify. So please, 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 please make sure that you wait until the money comes in before you make any distributions. When we're looking at the calculation of the average hours, you have to include all forms of hours worked per se. So disability, FMLA, COVID leave, paid time off, those all get included. Overtime hours, on the other hand, does not get included. So if you have any staff that earn overtime, when you're calculating out the hours, you have to back out the overtime hours in terms of that calculation. But any other time that the employees have, whether, again, if it's paid or unpaid Family Medical Leave Act or anything else, paid time off for vacation time or holiday time or sick time, all of that stuff gets factored in terms of calculating the average hours for purposes of the calculation. Qualified employee is eligible for up to 2 vesting periods per employer. So, and they don't get to pick which 2 vesting periods they want to choose. My understanding, and there was a question about this that came out earlier today, but my understanding is the first 2 periods that they're eligible for are the first 2 that they get the bonus on. So they can't sit here and say, well, I'm only going to work get a bonus of $500 this time because I'm only going to work 20 hours. And the time after that, I'm only going to work 20. But after that, I'm going to go to full time and get 40. So I'm going to hold off, not take the bonus for the first 2, and take the 3rd and the 4th. I don't see anything in the regulations that allows you to pick and choose what period you want to get your bonus in. So to me, it looks like as soon as you're eligible, you have to submit for it, and you would get the bonus as soon as you're eligible. Now, again, you only get 2 vesting periods. The maximum an employee can get is $3,000, right? Because you can get $1,500 for each of 2 vesting periods if you work over 35 hours or above. You can get, an employee can get a bonus from multiple employers. So if I work 20 hours for your agency and I work 20 hours for another agency, I would qualify for a $500 bonus from each agency for 2 periods. The maximum I can get is $3,000 in total. So let's say, for argument's sake, I work 30 hours for you in period 1, I get a $1,000 bonus. I drop down to 25 hours in period 2, I get $500. I move to another agency, I work 30 hours there, I'm entitled to another $1,000. And then I move to a 3rd agency and I work 30 hours, I'm entitled to another $1,000, but that would put me at $3,500. So I only get a bonus of $500. So if employees move around, they can get bonuses at multiple agencies, but the maximum bonus they're allowed is $3,000. I bring that up because if someone moves into your agency and they weren't there during the first 2 vesting periods, you're going to have to make sure you understand what they've gotten already. Now they have to attest to it. So you're not responsible for reaching out to anybody other than the employee, but the employee is responsible for disclosing to you. And that's one of the reasons why you have to have the attest form. And one of the reasons why you might want to modify the attest form and actually ask as part of the questions, have you received bonuses in the past? If so, how much? So this way, at least you have that information so that when you're filling out or getting the attestation forms, you know what the limit an employee could have is. Because again, the maximum they can have is $3,000. Claims must be submitted within the 30 days after the vesting period. For those of you who haven't already filed for period one, they did give us an extension on period one, where the claim period would be October 1st to October 31st. And that's also the same claim period for period two. As I said, you need to get attestation forms. The DOH did give you the ability for the first two vesting periods, since you can file the same claim period in the same time period. For that first two vesting periods, which covers the period October 1st, 2021 to March 31st, 2022, and April 1st, 2022 to September 30th, 2022, which is going to be due by the end of this month, by October 31st, you can get one attestation form for both of them. But after that, you're going to need a new attestation form for each new vesting period. Employees must complete, as I said, the vesting period, the attestation form. Bonuses must be paid no later than 30 days after the funds are received. So you have a requirement to pay the funds within 30 days, the day the check comes in from the Department of Health. I have gotten a lot of questions from EI providers who have staff that are paid on a per unit basis, whether it be, let's say, an evaluation staff or a service coordination staff. And the question has come up, well, how do I equate that in terms of hours? And I would say, whatever you guys are doing, since there's no clear regulations, whatever you're doing with respect to the New York City or New York State sick pay regulations, I would follow the same thing. So if you're charging or putting in for sick pay, a half an hour per unit, 15 minutes per unit, wouldn't be half hour, 15 minutes per unit, 10 minutes per unit, whatever it is you're doing, whatever you are putting in under the sick pay guidance, I would do the same so that you're consistent. So that if there was an audit, you can kind of show, hey, look, I'm doing it this way for the healthcare worker bonus. I did it exactly the same way in terms of calculating how much sick pay time off employees are allowed to have. So again, I think consistency is going to be important. This, I think I already mentioned this. If you, you have to get the money first, you have to pay the bonus after the claims are received. It's right within this frequently asked questions. So just keep in mind that you don't want to prepay any bonuses, because those won't count towards the healthcare worker bonus. All right, let's talk about the vesting periods. So from a vesting period perspective, there are 5 vesting periods that are going to come into play. You have, as I mentioned already, the 2 that have already passed, 10/1/21 to 3/31/22, and 4/1/22 to 9/30/22, which are all due by the end of this month. And then you're going to have, again, 3 similar 6-month periods, 10/1 to 3/31/23, 4/1/23 to 9/30/23, and 10/1/23 to 3/31/24. Each one of those, again, it's right after the vesting period's over, you're going to have 30 days to file. So you have the dates here as to when the filings need to take place. There's been a lot of questions also regarding, hey, what happens if someone leaves? Do they still get a bonus? And the answer is, it depends. If somebody was there for the entire vesting period, okay, and after the end of the vesting period, you fired them, all right? And it wasn't because they are no longer eligible for Medicaid. So remember, they have to be in order to be a qualified employee, they have to be Medicaid eligible. So if they are no longer a Medicaid eligible employee because they're disqualified by Medicaid or some other reason, then they don't get a bonus. But outside of that, there's nothing within the regulations. If you fired someone for cause, there's nothing within the regulations that says that they're not entitled to a bonus. So if they were there for the entire vesting period and subsequent to the vesting period, you terminated them, then they may be entitled to the bonus. And this chart kind of lays that out for you. Those final 3 is for eligible, sorry. So again, when we look at it, so if the employee vested was employed at the time of the claim, and then the employee is terminated by the employer, that orange bar, if you terminate them and they were there for the vesting period, they're eligible for the bonus. Okay, again, unless they are no longer qualified under Medicaid. The big question comes down to what happens if an employee leaves on their own accord. Well, if an employee leaves on their own accord, I'll make it simple for you. Unless they are there by the due date of when you have to pay the money, they are not eligible. So if they work the whole vesting period and leave 3 days after the vesting period, they are not eligible. If they work the whole vesting period and you file for the claim for them on October 27th and they leave October 28th, they are not eligible. If they work the whole vesting period, you file for the claim for them on October 27th, and therefore you have to pay them on September 26th. If they leave anytime prior to November 26th, I'm sorry, I meant to say November. If they leave anytime prior to November 26th, unless you paid it earlier. So if you paid the bonus on November 16th, they get to keep the bonus. If they leave after the payment of the bonus, it's theirs. But if you don't have to pay it till November 26th, and on November 25th, they leave and you hadn't paid the bonus yet, they don't get it. If now it was due on the 26th and you paid it on the 28th and they left on the 27th, they do get it because it was due on the 26th and you didn't pay it, so they're still entitled to it. So this chart pretty much does a really good job of laying out all of that. Take a look at the chart, but keep in mind, if the person left on their own accord, it's a longer length of time where they forfeit the bonus. If you terminate them, it's a shorter period of time. As long as they were there for the vesting period, it's their bonus. Threw out a question regarding income tax because the healthcare worker bonus is not subject to income tax. What this means is that, you know, if you're doing your payroll in-house, you have to make sure that you're not withholding state taxes, state and local taxes from the employee's pay for the bonus because it's not subject to state and local taxes. If, on the other hand, you're using an outside payroll service, please make sure you communicate with your outside payroll service. Please make sure they understand that this is being paid out under the healthcare worker bonus program and that it is not subject to income tax so that you're not withholding income tax for this. When you get your payment from the Department of Health, your payment is going to be for the bonus amount, plus it's going to include 7.65% for Social Security and Medicare. So that's the employer portion of Social Security and Medicare. So that amount will be going to you to help pay for that Social Security and Medicare. So you're not going out of pocket for that. They're not covering any other benefits. So if you have a pension plan that covers all salary, all bonuses and stuff, they're not covering that. So you have to decide whether it's something you want to exclude from your bonus. This is going to be with us for the next, year and a half on top of the year that's already passed. So you have to determine if you want to change your plan to exclude the healthcare worker bonus from any pension contributions. If your definition right now within the plan includes any bonuses. And if there are any other out-of-pocket expenses for such things as workers' comp and stuff like that, you may be responsible for that. But understand that they're going to pay you for the bonus and they're going to cover your self-employment tax. When you go to do your submission of your bonus, a couple things to keep in mind. You must, at the time of your submission, include 2 documents. You have to include your employer attestation form. And if you click on this here, this is a link that'll bring you right to the employer attestation form. And you can download a copy of it so you have it, but you're going to have to upload a copy of that employer attestation form. In addition, this is the link to the Excel file that's utilized for purposes of that you have to fill out and submit with the application. Please understand that Excel file, you need to follow along exactly with the information in the exact format it's supposed to be in. Don't add any extra columns, don't do anything extra to the spreadsheet. There are pull down menus for the employee titles. There's pull down menu in terms of who the agency that you're funded by. There's an issue because when we looked at this, there's SED is not listed as one of the agencies. So we're going to have to follow up and find out why and what we need to do there. But you have to follow this spreadsheet because the DOH has readers that go in and read the spreadsheet. So if there's anything that isn't where it belongs, if it's not filled out the right way, if you have stray comments or stray issues and things in there, it's going to be rejected. And it's going to drive you crazy to try to figure it out. So just make sure that you completely follow the formats there. The question is, you upload the Excel template file, including all sheets in the original file. So when you upload, you're going to upload, this is the template that's right on their website. This is the template you're going to use when you upload. So this is what you should be using when you fill in the information. Follow this exact format. When you upload, you're going to be uploading the attestation form and you're going to be uploading the Excel spreadsheet. So this template is going to be extremely important. This is what you need to use. If for some reason the link isn't working, you can go right to the website and grab it off the website. It's right on the healthcare worker bonus portal, and you can grab the spreadsheet off the portal. I mentioned before that the OMIG will be auditing payments released by eBedney. So your payments are going to be coming in. OMIG hasn't decided, or there's been no indications what the audit protocols are going to be. No indication as to who they're going to be looking at, what they're going to be looking at. Just understand that within the regulations, it states that OMIG has the right to do these audits. And then if a qualified employer, if you make a mistake and you fail to identify someone who's entitled to a bonus, if you don't claim a bonus that you should have, if you pay the wrong bonus, pay to someone who's not entitled to the bonus, any of these things, and your error rate, according to the regulations, is more than 10% of the bonus eligible workers, you may be subject to a penalty up to $1,000 per violation. Question is, what constitutes a violation? So if I missed 10 people who are supposed to get a bonus, is that one violation or is that 10 violations? It's not clear from the questions and answers that exist at this point. I figured everybody would have like 3,000 questions on this, so I wanted to leave time for questions. So if anybody has any questions, please throw them out now. More than happy to answer any questions that anybody has. Okay, got a question here. Clinical coordinator supervisors, if they do both SEIT services and coordination supervision, can they qualify? So I got clinical coordinator supervisors. I mean, typically a clinical coordinator is an individual who is overseeing therapists, and typically a supervisor is an individual who's overseeing a teacher. If I'm using the same staff member to do both, and that clinical coordinator fits into the definition under Schedule R, or Appendix R, I should say, of the CFR claiming manual, then I think the answer is yes. Because remember, we go back to those questions and it said, does a person need to be performing wholly the job? And they go back to the title. And as long as the title is an allowable title, which in this case would be clinical coordinator, they don't have to spend 100% of their time doing clinical coordination. They could do some of their time doing other functionality. I would just be careful in terms of making sure that a SEIT or a teacher can provide clinical coordination services. Typically, teachers are providing curriculum coordination and IEP coordination, not necessarily clinical coordination. Clinical coordination is normally done by a therapist or a counselor. If an employer refuses to sign the attestation form, are employer liable in an audit for not including them? No, that's why I said make sure that you have proper documentation as to the fact that the employee did not sign and what you did to try to get them to sign and why they refused to sign. Document all of that. If they're refusing to sign, I would see if you can get them to sign something that says they refuse to sign. But whatever you can do, whatever you can document, I would document, because that's really what's going to be, the underlying to save you. EI preschool providers, therapists doing services for both programs, hours and wages for both are added together to determine whether a person qualifies for which bonus amount. I would say if you're dealing with a single entity, the answer is yes. If you are dealing with multiple entities, again, it comes down to whether those entities are connected through a common MMIS number or SFS number, or whether they're separate. If they're separate, then the answer is no, you wouldn't combine them. If they are under a single, or you can file under a single claim, then the answer is yes. But if it's one entity, yes, you would have it all under, and you would add it all up. If employer termed person and they should get bonus, we still need to attempt to get them to sign. That's correct. Is there any preferred way to show our attempts? I would do emails, as you said here. If you're not getting response to emails, you can do certified mail if you want, but remember, we don't have a whole lot of time here. So if you're going to do something like that, you want to do it quickly, because again, it's already October 11th and this has to be in 20 days. What I would suggest is that if you are going to do an email, make sure you have a good email address, determine how you verified it, see if you have a phone number, try to do an email and a text to see if you can get there, call the individual, just document the steps that you did in terms of, on such and such a date I did this, on such and such a date I did this, on such and such a date I did this. That you've got documentation that you tried to get in touch with the individual and you were unable to. That's gonna, create a situation where if the OMI comes in and says, you didn't give this person a bonus, you can say, I tried, but I couldn't get them to sign the attestation form. Here's the log of the attempts I made. And I don't know that there's a correct number of attempts, but you got 20 days. So I would think in the next 20 days, you should be able to get 4 or 5 attempts in. Thank you, everybody. Appreciate your time. And again, if you have any questions, if you want to, my contact information is here. The handouts are within the chat, and we'll be sending out a copy of the video and a copy of the handouts to everybody. So if anybody wants to, they feel free to reach out. Thanks, everybody, and take care.